What you see here, this is pretty much the basic supplies that you would need so that you could properly hook yourself up. In my case, I hook up, well, I used to hook up here, the 2 needle lines. Ironically, the last month before transplant, I had 2 needle points established. All this is set up at the hospital, at the clinic. You want to make sure, or the nurses make sure that they have a proper access point. In my case, we had some complications in the beginning where it was starting in my forearm, but we opted to go up to my non-dominant arm, my right, and needle up here. So they want to make sure that you know as a patient at home that you could properly needle. So they use the proper tools there. They start with a smaller diameter needle and they work their way up. But prior to that, they have to prepare your arm, and that's what they call a fistula. So a fistula is basically taking a line of your arterial and your venous and connecting them so that you could create a large diameter line where you're going to dialyze. In my case, I have a natural fistula that I enter through what they call a buttonhole. Okay, one hole is for your arterial, which draws the blood to the machine, and the other one is your venous, which brings the clean blood back to you. And you want to make sure that those are the needles are properly inserted and taped down securely when you're dialyzing.